My dear viewers, Assalamu alaikum. Today I like to discuss one of the most important topics which is very much valuable in our daily clinical practice. This is called viral hepatitis. Viral hepatitis is a major health problem both developing and underdeveloped countries all over the world. Remember this. Now, the disorder, viral hepatitis is caused due to 5 types of hepatotropic virus. This is hepatitis A, B, C, D, E. These 5 types of hepatotropic virus, it is about 90%. Rest 10% is non-hepatotropic virus, which is cytomegalovirus, herpes zoster virus, then Spindler virus, adenovirus, enterovirus, parvovirus B19. This is called 10%. This response with 10%. Now is another cause is due to autoimmune cause. Autoimmune cause of hepatitis is due to the sclerosis, cholangitis, SLE, and GIA. Remember this. Now another one is metabolic cause. Metabolic cause is due to alpha-1 antitrypsin deficiency, galactosemia, cystic fibrosis, and Wilson disease. Remember this. Then next cause is due to the drugs and toxin. What are drugs? Here drugs is methyl dopa, antitubercular drugs. Then the methotrexate and mushroom poison. Remember this. First of all, you have to know the pathogenesis of the viral hepatitis. You should know the pathogenesis of the viral hepatitis is due to the injury to the hepatocyte. Virus involve both the cytopathic and immune-mediated injuries to the liver parenchyma. Remember this. Degeneration and necrosis of the liver parenchyma cell. Remember this. Complete recovery occur in hepatitis A virus, but hepatitis B, C, D is always the fate of the hepatitis B, C, D is chronic active hepatitis, chronic persistent hepatitis, and cirrhosis of the liver and hepatocellular carcinoma. Remember this. Now, what are the types of the hepatotropic? Which types? This hepatotropic virus is all the hepatotropic viruses RNA virus except B virus, which was the DNA virus. Next, how the transmission of the hepatitis B and E. Hepatitis B, D, E is parenteral routes, but hepatitis A and E is orophycal route. Next, what is the chronicity? Chronicity is always B, C, D, but A, E is not chronicity. Next, fulminant hepatic failure. Fulminant hepatic failure occur always B, C, D, sometimes in E also during pregnancy. Remember this. Now, how the patient is present to you is presentation. How the patient is present to you is very much important. What the patient is complaining to you, there are 3 phases. We included 3 phases. One is pre-ecteric, ecteric, and post-ecteric phase. Pre-ecteric phase, what happened? Loss of appetite, myalgia, fever, some sickness like condition. Sometimes the low-grade fever and there is a pain in the upper right quadrant. Then ecteric phase. Ecteric phase, there is the deep jaundice with dark urine and hepatosplenomegaly, lymphadenopathy. These are the features of the ecteric phase. Next one is post-ecteric phase. Post-ecteric phase, that is jaundice disappear and hepatitis appear. This is the post-ecteric phase. Now, what are the clinical signs? What is the sign of the viral hepatitis? Sign is tender hepatosplenomegaly, lymphadenopathy, and there is the ectodermatitis. Ectodermatitis, it is one kind of maculopapular rash, which is simply is called Zygonti cause syndrome. Remember this. Now, what are the investigation? What the investigation do for this viral hepatitis? First of all, we given complete blood count and liver function test. Liver function test we do serum bilirubin, serum AST, ALT, prothrombin time, and alkaline phosphatase. This is the liver function test. Next, we go for some renal function test, serum creatinine and blood urea. Remember this. Next, we go for PCR detection. PCR for viral DNA RNA detection, and liver biopsy should be done to see what is the cirrhosis of the liver or chronic liver disease. Finally, we go for one ultrasonography hepatobiliary system to see any architectural changes of the liver parenchyma. Remember this. Now, Now let's go for some viral marker. There are two types of viral marker, by antigen and antibody. We collection, we did viral antigen and antibodies. Antigen, hepatitis A. Hepatitis A, in case of hepatitis A, there is a hepatitis A virus IgM and anti-hepatitis A virus IgG. Anti-hepatitis A virus IgM indicates recent infection, and anti-hepatitis A virus IgG indicate for lifelong protection. Remember this. Next, B, hepatitis B virus. Hepatitis B virus, there are 3 antigen and 3 antibody. Remember this. 3 antigen means it is hepatitis B surface antigen, hepatitis B E antigen, hepatitis B C antigen, core antigen. That is core antigen. Now the antibody against this antigen is hepatitis B anti-hepatitis B surface antigen. It indicates the lifelong protection. Then hepatitis E anti-hepatitis A E means it is a seroconversion. Then anti-hepatitis B core antigen. It is two types, one IgM type and IgG type. IgM means it is a recent infection, and IgG means chronic infection. Remember this. This is all about the viral marker. Finally, what is the treatment? All the children is not, all the viral hepatitis patient is not required to a hospital admission. Just if there is a warning sign, then you admit in the hospital. What are the warning sign? Persistent fever, anorexia, deep jaundice, bleeding tendency, altered sensorium, gastrointestinal bleeding, the fluid retention, decreased liver size, and in some time there is some relapse remission is the natural disease, natural history of the disease. Remember this. Now the specific treatment in case of hepatitis A virus, no need to specific treatment, just supportive treatment is enough. Given the fluid and nutrition and complete bed rest until unless signs symptoms disappear. But hepatitis B requires the treatment. What the treatment is given for hepatitis B virus? We given the interferon to alpha 2b. Alpha 2b interferon should be given 5 to 10 international unit per square meter body surface area subcutaneously every alternate day for 6 months, and also given lamivudine. Lamivudine should be given 10 to 15 milligram per kg of the body divided dose for another 6 months. This is the treatment for hepatitis B virus. But in hepatitis C virus, we given the interferon, alpha interferon and ribavirin. Alpha interferon should be given 3 to 5 international unit per square meter body surface area for subcutaneously every alternate for 12 months, and also ribavirin also given for every alternate day for another 12 months. Remember this. This is all about the treatment of the B virus, C virus, and hepatitis A virus. Now one thing is you should remember this. One thing you should remember, this one is INR, is very much important. One is INR. INR means international normalization ratio. What is the international normalization ratio? Is the ratio between the control and patient serum prothom mean time. And what is the indication of the INR? The indication of the INR is to see the adverse effect of the warfarin and monitor the liver function test. Remember this. When the INR is more than 1.5 international units, then thinking the patient is going to the liver failure. So we are conscious about the treatment of the patient, and we should given the vitamin K injection for the prophylaxis. This is all about the patient. Thank you very much for patient hearing.